Hello, Dr. Jesse Houghton here, gastroenterologist, board certified in both internal medicine as well as gastroenterology, author of the brand new book, What Your Doctor Doesn't Have the Time to Tell You, The Gastrointestinal System. The book comes out on May 18th, although you can pre-order the ebook version on Amazon at the following address. The book covers all major gastrointestinal conditions, from acid reflux to constipation and everything in between. Let's take another topic covered in the book, a hiatal hernia. Most people have heard of a hiatal hernia, but are not exactly sure what it is. A hiatal hernia is a hernia involving the diaphragm. The diaphragm is a thin sheet of muscle that separates your abdomen from your lungs. There's a hole in the diaphragm through which the esophagus travels and connects to the stomach, which sits underneath the diaphragm. In the case of a hiatal hernia, the lower part of the esophagus and top part of the stomach pop up through this hole in the diaphragm, creating a pouch. The more of the stomach that pops up through the diaphragm, the bigger the hiatal hernia. What this does, in effect, is loosen the normal sphincter mechanism of the lower esophagus, making it easier for acid reflux to occur. It can also cause a discomfort in the lower sternal area, especially when bending over. A small hiatal hernia is very common, small meaning 1 to 2 centimeters or so. How do we treat a hiatal hernia? Well, nothing necessarily needs to be done if it is not causing symptoms. Symptoms would include heartburn, acid reflux, discomfort in the upper abdomen. Non-medication treatment includes elevating the head of the bed. This may seem trivial, but it can make a big difference, especially when dealing with a large hiatal hernia. The most effective way to do this is to place wood blocks or risers under the head posts, so the whole top of the bed is inclined. If this is not feasible, an alternative is to buy a wedge pillow and place it under your regular pillows. Just adding a few regular pillows has been shown in some studies to not be effective. Also, don't eat anything at least 2 to 3 hours prior to going to bed. Eat small, frequent meals, and avoid foods that normally cause you problems. This is usually spicy foods, chocolate, citrus, onions, and fatty foods. When diet and lifestyle modifications are not enough, we turn to medications. We usually prescribe a PPI or proton pump inhibitor. This would include Protonix, Nexium, Prilosec, etc. These medications treat the acid reflux that occurs as a result of the loosened lower esophageal sphincter with a hiatal hernia. These medications are very effective at treating symptoms associated with a hiatal hernia. With larger hiatal hernias, I often add another medication called Carafate or Sucralfate. Given as a liquid, this medication coats the esophagus as well as the hernia sac. The downside, this medication is taken 3 to 4 times a day and it has to be taken separately from other medications and food, ideally. If the patient prefers not to take medications, or if they are still having symptoms despite these medications, we then start to discuss surgery. The most common surgery done to fix a hiatal hernia is a fundoplication, with the most common type being a Nissen fundoplication. With this surgery, the stomach is brought down into the proper position, and the top of the stomach is then wrapped around the lower esophagus, thus recreating the sphincter mechanism. Well, that's it for this topic. Tune in later for more GI topics from the book. And please, if you have any questions, email me at info@gastrodoc1.com. That's info@gastrodoc1.com. Be well, everyone.